Okay, all right. So we are going to talk about pandemic and the health system. And there is basically nothing to talk about the pandemic per se, because this word has become a household word nowadays. Everybody understands what is a pandemic. If you want to address pandemic, you cannot address it through an individual approach. It is important to understand that a disease is an independent or individual experience. Okay, it's an individual experience. If somebody gets an individual experience, but if there is a pandemic, is the same time are suffering from, you need a health systems approach. You need a health systems approach. So in order to address a pandemic, you need a good understanding of the health system. Okay, so we'll be talking about the structure of the health system, and then we will talk about like some research. Since your main theme of this conference is research, we will talk about some of the health systems research that can be done. Even students or with the help of some faculty members can do some research on the pandemic issues or the health systems issues related to pandemic. My name is Taufique Joarder. I'm the executive director of Public Health Foundation Bangladesh, and I have been teaching in several places. Now I'm actually discussing about the health system. My PhD is on actually health policy and health system, so it's very relevant to my area of expertise. So I'm actually showing you a picture. Okay, what picture is this? Any idea? An ocean, but this picture is actually taken from a movie. Do you remember? Arrival. The name of the movie is Arrival. Have you heard the name? So do you remember a little bit of this movie? People, some aliens actually came from Mars to the Earth. Okay, shape element that you can see in the picture is actually a ship. Okay, and these people actually came to Earth, but the problem is that these people do not the language of the human beings. Okay, so imagine me. Okay, imagine me as a Martian or an alien who does not speak your language. But that is the theme of the arrival. I came to the Earth. I want to understand about different aspects of this universe, this Earth. Okay, is it clear? Now, you have assignment. Your assignment is that you what is a health system. But the limitation is that you cannot speak anything. You cannot talk. All you can do is draw pictures or draw diagrams or something like that, and make me understand what a health system is. You have 5 to 10 minutes maximum. Okay, so we will start this exercise. Is it clear to you? Okay, so we will start a page with you. In that page, you will actually need to draw some picture. Yeah, you can start drawing the picture. So you can discuss among yourselves actually. Okay, you can turn off the mic, me, or if you are close by, you can discuss among yourselves, in, messenger or anything, and draw a picture of what is a system. So if you want to understand a health system, first we need to understand what is system. Okay, so can you remember any system, since you are actually medical students or medical graduates, you just graduated, so can you tell me what is a system, or can you imagine some systems that you are familiar with, some parts? So any system that you imagine is an interaction of parts and their interconnections. So there are some parts and they're connected together, and they come together for a purpose. That's called a system. So respiratory system has a purpose related to respiration. Cardiovascular system, it has parts, they're connected, and they come together for circulation of blood. If you imagine nervous system, there are some parts, they're connected, and they also come for a purpose. Okay, so this is basically the general definition of any system in the world. Any system. Okay, so A system has parts and parts are connected, but in a non-system, parts are independent. They are not connected. In a system, changing one part or a connection affects other elements of the system. So if you change one part, for example, if you, if there is is any issue with the heart, it affects the other parts, right? It doesn't remain only in the heart. It affects your vessels. It affects other system, other functions. But in a non-system, changing one part does not necessarily affect other elements. And this, in a system, parts operate towards a purpose, while in a non-system, there is no explicit purpose. So now my next question to you is, then what is a health system? The person who can give the shortest possible answer will be the winner. It's going longer. So this is actually what I'm asking for. Any system that has a purpose related to health. So you don't need to actually tell or repeat the definition of a system, okay? Like coordination and these things. These are called a system. So a system is a health system. Okay, this is the shortest possible definition of health system. Okay, and we learned what is a system, so we don't need to actually tell that definition, repeat that definition when we are talking about health system. But this is actually an informal definition for our understanding. But WHO has its own definition, which is important for our understanding of the health system. It is called all the persons, institutions, or activities whose primary intention is to promote, restore, or maintain health. Okay, is it clear to you? All the persons, all the institutions, all the activities whose primary intention, okay, not secondary, tertiary, whose primary intention is to promote, restore, or maintain health is a health system. Okay, now I'll have a quiz with you. Okay, a quiz and then a video. So okay, can you remember the question? A granddaughter in a Bangladeshi village carrying her diabetic grandfather. Huh? Her work is a part of a health system. True or false? Now, next question. Okay, I mean, I can tell you the question again. I mean, the next question is about a farmer doing a farming in a field. Okay, growing paddy. Is it a part of a health system? Okay, true or false? A farmer in a Bangladesh is growing paddy in his field, contributing to nutrition. His work is part of a health system. True or false? Okay, so let's see. So in the first question, it was about a girl who is caring for his her grandfather. So it was so let's see the definition. All the persons, institutions, activities. So in this exercise that we did, there is a person, okay, the girl or the activity. She's treating or helping health-wise, helping her grandfather, caring for her diabetic grandfather or something. Okay, and primary intention is to promote, restore, or maintain health. Next question. So in the next question, we showed a farmer who is developing or producing paddy. Okay, and the paddy and it contributes. We know. I mean, this contributes to some extent or in some way to nutrition. That's why it's important to understand this definition. It's not as simple as it seems in the face value. It has a lot of nuances. So persons, institution, activities whose primary intention is to promote, restore, or maintain health. And this is a very broad definition of health. So it doesn't include only the health caregivers working in a health hospital. So we need to actually come out of our hospital-centric point of view of the health system. The people who are working in the community, okay, aren't they contributing towards the health system? They are also part of health system. They work in a very important ways to contribute to the health system. Okay, all our EPI service was actually a significant part of our expanded program on immunization was dependent on community-based services who are not even trained in the first place. Those people helped us to roll out this expanded program on immunization in the field, but they were not formally trained. They were not doctors or nurses or anybody. So it's very important for us to recognize that all the person's institutional activities, as long as their primary intention is to promote or restore or maintain health, their activities or intentions or their work, or they are actually part of a health system, irrespective of their designation or training or education or whatever it is. Is it clear? Okay, let's watch a video and then we will catch up the discussion. Let's watch. I mean, it's a long video, but I will show only 3 minutes of this video. Okay.
This is Alma. Alma designs health programs, and she has started to notice interventions that get funded each year in her district seem to have one thing in common. They are mostly simple. Funding for health programs is tight, and her government wants to spend its limited cash on interventions that don't have too many components, so they are easy to understand and manage, and low cost. Alma notices that these interventions are also linear. Managers assume that in whatever context they are implemented, if you do X, you will always get Y as the result. And if you do more of X, you get more of Y. There's just one problem, and it's the third thing these interventions have in common. They fail. A lot. The more Alma looks at it, the more she sees that trying to run a simple, linear intervention in the complex, messy real world seems not to work a lot of the time. For example, after an outbreak of influenza, the government made the flu vaccine freely available in public hospitals and paid nurses to do vaccinations. Simple, thought Alma. But instead of quickly stopping the epidemic, hospitals were flooded with people demanding the vaccine, and doctors and nurses were distracted from their other work, so other diseases weren't treated. Private health insurers stopped paying for the vaccine, so their customers showed up in public hospitals to be vaccinated, making things even worse. Flooding on roads prevented vaccines from getting to some parts of the district, so then Alma had to deal with angry community members demanding to know why they were being left out, and angry staff who were missing out on the incentives. It seemed like the people who designed the intervention had just focused on the simple problem of giving a flu vaccine, and assumed that the staff, patients, facilities, insurers, and weather wouldn't affect the program or react to it. If you assume that health systems are simple and linear, it makes sense to plan simple, linear interventions. But health systems aren't simple and linear. They are examples of complex, adaptive systems. Let's look at what that means. Systems means that you can't break down health and health services into little parts. Everything is connected to everything around it. Every facility, every program, every person, and every policy is connected, directly or indirectly, to everything else. And these things connect to everything else in the world. Politics, economic systems, culture, climate and weather, infrastructure. Everything is connected. Adaptive means that when some part of the system changes, the system itself changes to adapt to the new situation, because all the parts are interconnected. Complex means that the way that the parts of the system relate to each other and the way the system behaves as a whole is non-linear and somewhat unpredictable. You can do exactly the same thing and cause very different effects each time. There are many interesting ways that parts of a complex adaptive system interact with each other. Understanding these can be very helpful in understanding health systems and in helping Alma do what is called systems thinking.
So, for example, now we are talking about COVID-19 vaccine. Do you think just having this vaccine in the country will solve the problem? Everything works. If you put these vaccines in a hospital or a Upazila health complex or a district hospital, there will be such a long queue that the existing human resources will not be able to manage it. Health system is highly complex, is adaptive, is a system. Okay, so it's called complex adaptive system. Why it is called complex adaptive system? Alma described that everything is connected. It's not just doctors. It's related to their available time, their workload, their training, their relation with nurses, nurses' relationship with others, and a whole lot of things. Okay, then it's adaptive. It changes. If you change just one thing, if just a COVID-19, it changed the whole lot of things in your surrounding. It is not like pre-COVID situation anymore. Everything is changed, and if you change one thing, every other thing will change. And it's actually very complex, because if you think that it worked in Chittagong, it will work in Rangpur. It's not like that. The same thing may work in Dhaka but may not work in Chittagong. So it's very complex. It's not very simple. That's why it's very important to understand the health systems from a very broad perspective. And it's a very difficult discipline. In our worldview, our doctors, our students, even some public health professionals, they think that, okay, health system is just maybe, I mean, just how hospitals run, how to train the nurses, how to keep the budget and stuff like that. It's not really. It's a very, very fragmented point of view towards the health system. It's very, very complex, and it's very, very complicated. It's very difficult to understand. It has a lot of things to discuss and study. Okay, so for making it easier, World Health Organization in 2009, in fact in 2000 basically, and it evolved, they developed a framework. Okay, they developed a framework to show what is the health system. And they say there are 6 building blocks in a health system. So these building blocks are, first one is the service delivery. So this is one that the doctors love the most, because they are directly related to the service delivery. But there are other parts like health workforce, like how you develop the health workforce, who are working in the health workforce, how you ensure that these people are working in the right places, and if you post them in a rural area, they are actually staying there and not going somewhere else. What incentives they need, why they don't work, why are not they motivated, what are the problems with their training. All these things are related to the health workforce. Health information, a lot of people nowadays don't believe in the data that's coming from the government, right? Related to COVID-19. Maybe it's true, maybe it's not, but we need a very good information system, and we need to have a transparent system so that everybody can challenge and get verification of the information. So we need a very good information system. That's also part of the health system. Medical products, vaccine, technologies, these are also part of the health system. Like if you import this high flow nasal cannula in Dhaka, but if you don't distribute it properly in the nooks and corners of the country, will it solve the problem of high flow nasal cannula? No. So this is also part of the health system. Somebody needs to decide how these things are distributed. If tomorrow a medicine is found for COVID-19, how do you think everybody will get that medicine? What do you think? It won't. So you need a system developed for this distribution of medical products, vaccine, and technologies. None of us actually think that health financing is part of a health system. And that's a major issue of the health system. Okay, health financing, we think that we go to a hospital, we pay from our pocket, and that's how it's solved. But it's not. In most of these countries, health financing is resolved or addressed by insurance mechanism, or in a different ways are there. Okay, out of pocket expenditure or out of pocket, the model that we follow in Bangladesh is actually the most primitive form of healthcare financing in the world, and we are still thinking that this is the only way of financing. So financing is one of the largest area of the health system, yet we don't even consider it a part of health system. And of course, you showed in your picture about leadership and governance. You talked about it. You said that there should be leadership, good management and stuff. But do you think the leadership will just develop just like that? You need to have a system of developing the leadership and governance in the health system. So all these things are part of or building blocks of a health system. And these things come together in the form that you ensure access, coverage, you need to ensure the quality of the care, quality of the information, quality of the health workforce. You need to make sure that all these things have a safety. The thing that you are giving are safe for the people. And the objective. We all think that this is the only objective of a health system. What is that? Improved health. But if you look at WHO's definition, there are four objectives or three additional objectives to improved health. That is responsiveness. What is responsiveness? When a patient comes to a doctor sometimes think that only giving treatment is his or her duty. But WHO says that that patient must be treated with responsiveness. বাংলাতে আমরা কি বলি এটাকে, যে আমাদের সংবেদনশীল ট্রিটমেন্ট দিতে হবে, সংবেদনশীল হতে হবে। We need to address their queries, we need to be respectful towards them, we need to be friendly. And it's not something that I'm making it up from my head. It is something that the WHO definition of the health system says. So there must be a system in the place which will ensure the responsiveness. Social and financial risk protection. We think that, okay, it's not our responsibility to make sure that আমাদের দেশে কি হয় যে মানুষ সেবা নিতে গিয়ে তার গরু বিক্রি করে দিচ্ছে, জমি বিক্রি করে দিচ্ছে। This is not supposed to happen. This is not a good health system is supposed to look like. Improved efficiency, তার মানে এই কাজগুলো করতে হবে এফিসিয়েন্সির সাথে। As long as we cannot address all these things, our health system's goals or objectives or outcomes are not really met. But the problem with this definition is that the health system building blocks are separated, but we learned from Alma's video that these things are interconnected. So there is another framework, okay, a more complex framework. It says we need governance and leadership, and we have different types of resources, institutions, supplies, human resources, knowledge, financing, and we have the service delivery mechanism. And this service delivery mechanism is governed by leadership, the resources are governed by leadership, and the objectives and outcomes are universal access, quality of care, responsiveness, in order to improve the health. And they added one important component, that is population. In the previous framework, there was no population. Okay, the population is an important component of the health system, because I mean, if you think of doctors are coming from the pool of the population. Who are the patients? They are also coming from the population. So you need to understand the population, their needs, their values and everything, their principles and everything. Okay, and the context is very important. Something that what context er bangla ki, প্রেক্ষাপট। যে জিনিসটা বাংলাদেশ ঢাকায় কাজ করে, সেই জিনিসটা যে জিনিসটা ঢাকা শহরে কাজ করে, সেটা হয়তো গ্রামে কাজ করবে না। সো ইউ নিড টু আন্ডারস্ট্যান্ড দ্য হেলথ সিস্টেমস কন্টেক্সচুয়ালি। Okay, there is another definition or another framework. It's also very similar to the previous one. There is people, there are service providers, there is a state, and among the provider there are public provider, there are private providers, and there are informal providers too, village doctors, kobiraj, which you don't recognize them, but these people are there. They provide more than 80% of the services, and you can't simply ignore them. Even if you don't like them, you cannot ignore them, because they are there and they have, good or bad, they have an impact on the health system. And all these things, all these the people, the provider, the state actually function through financing mechanism. There are input management, human resources, knowledge, technology, and service provider. And there is an oversight function or the leadership, regulation, strategic partnership. And all these things come together to improve the health status, to protect the people from impoverishment. তার মানে হচ্ছে ওই যে ফাইন্যান্সিং এর কথাটা কিন্তু এখানেও আছে, and trust and satisfaction, responsiveness. অর্থাৎ what I'm trying to say is that we tend to think that health system is only to improve the health status, which is very, very wrong. It also wants to make sure that people are not impoverished. তারা সেবা নিতে গিয়ে গরিব হয়ে যাবে না। That's also an objective of the health system. তারপরে হচ্ছে ট্রাস্ট এবং স্যাটিসফ্যাকশন অর্জন করাও হেলথ সিস্টেমের পার্ট। And this is the final framework that I'm going to show you. This is actually, if you remember the first one, এখানেও same জিনিসগুলো আছে: governance, information, financing, service delivery, human resources, medicine, technology. কিন্তু এখানে একটা জিনিস করা হয়েছে। ওখানে যেমন in the first framework, it was, all these things were shown as separate entities like building blocks. But here, these are interconnected. Okay, if you look at these are all connected to each other. So that's important message. And people are actually encompassing everything, is connecting everything. So people is actually at the center of everything, which you can never ignore. So people is the nucleus of a health system, and everything that goes in the health system should be thought carefully from the perspective of the people, not from the doctor's perspective, not from the leader's perspective. It should be done from people's perspective. So my question to you is, who are the actors in a health system now? Now that you have understand better about the health system, so can you tell me who are the actors? Think about the actors, we tend to think about the formal providers, that is the public sector formal providers like doctors and nurses and SSCMOs. We think about the for profit private providers like the big hospitals or clinics, or we think about the not for profit private providers like the NGOs. But we seldom think about the household and the community and informal providers who are surrounding us and who provide the most of the treatment. 90 80%, more than 80% of the treatment is provided by them. There are studies on those who work in the hospitals, but you, in the first place, unless I provoked, you did not talk about the household and the community and the informal providers, isn't it? So it's very common for us to ignore a large chunk of our health system when we talk about the health system. But there are other health system actors too, like the local government leaders, financing. You talked about the financing, like insurance thing, regulatory agencies, pharmaceutical manufacturers, medical equipment manufacturers, those people who work with the medical information, faith-based and philanthropic organization. If you go to Rohingya camps, you see a lot of faith-based organizations working there, Muslim Aid and blah blah blah. There are civil society who are talking so much about COVID-19, who are talking the most in the media about COVID-19 situation. Is the civil society. You like it or not, but they are actually most vocal about the COVID-19. International organizations. So aren't they part of the health system? Aren't they working to improve the health system in some way? They are. So so what are the functions? So the functions are basically service delivery, financing, managing the inputs, and oversight. So so for example, the service can be organized according to the service delivery points. If I ask you, where can I see the health system services? So first you need to understand, just the health service is a part of the health system. But when I ask a doctor, they always talk about the service. So what are the services? The service that are delivered in a clinic or a hospital, or if you are working in the government sector, you talk about the government administrative area. Okay, service that are given in a district, that is from the district hospital, or an Upazila from Upazila Health Complex, or an union sub center at the union level. Or you can think about the services from the management unit, especially if you are working in a hospital, if you are doing internship, there medicine ward, gynae ward, surgery ward. So if I ask you, I mean, how do you classify the services? You can tell that, okay, the service of a medicine ward or surgery ward. You can think of services from the lens of profession, the service provided by the physicians, service provided by the nurses, service provided by the SSCMOs. If you are working in an Upazila Health Complex. Okay, so so service can be seen from different ways. Next function is the financing, that the doctors usually ignore the most. They don't even think that this is part of a health system because we are not trained to think in this way. What are the main financing function? First is that financing itself, like who pays, what are the sources of funding. So এই যে hospital চলে, উপজেলা হেলথ কমপ্লেক্স চলে, ডাক্তারদের বেতন হয়, একটা অ্যাম্বুলেন্সের তেলের টাকা আসে, where do you think this come from? Somebody definitely pays. এটা তো গাছ থেকে পড়ে না, তাই তো? So how this financing is managed? That's a very important question in health system financing. It's a very big part of health system. Then pooling. Pooling is how is the money pooled in an insurance scheme? আমাদের দেশে টাকা যেটা আসে, ট্যাক্সের মাধ্যমে টাকা আসে, সেটা জমা হয় ফাইন্যান্স মিনিস্ট্রির হাতে। ফাইন্যান্স মিনিস্ট্রি প্রত্যেক বছর একটা বাজেট করে, and they distribute it. But this is not the optimum system. If you go to UK, the health has an earmarked budget that goes directly to the health services. তারা এই টাকাটা জমা করে রাখে এবং according to their need they use it. So that's the pooling mechanism. Then purchasing, I don't want to go into the details. So who provides the how the providers are paid, ডাক্তারদের বেতন কিভাবে হয় সেটারও কিন্তু আমাদের মনে হয় যে গভর্নমেন্ট সেক্টরে কাজ করলে ডিজি হেলথের থেকে, ডিজি হেলথ তাদের প্রমোশন সবকিছু নিয়ন্ত্রণ করে, তাদের বেতন, তাদের স্যালারি সবকিছু সেখান থেকে নিয়ন্ত্রণ হয়। বাট দিস ইজ নট দ্য অনলি সিস্টেম, দেয়ার আর ডিফারেন্ট ওয়েজ অফ, ইটস কল্ড পারচেজিং। ওকে, so government এটাকে নানাভাবে পারচেজ করতে পারে, there are different ways, but we never explore because we don't know, we don't care about our health system. আমরা সবসময় বলি যে আমাদের সিস্টেম খারাপ, সিস্টেম খারাপ, কিন্তু আমরা কি কোনোদিন স্টাডি করে দেখেছি হোয়াট ইজ আ সিস্টেম? আজকের আলোচনার আগ পর্যন্ত আমার মনে হয় যে আমাদের ম্যাক্সিমাম যারা ডাক্তার হচ্ছে, যারা হেলথ সিস্টেমের সবচেয়ে গুরুত্বপূর্ণ, অন্যতম গুরুত্বপূর্ণ ভূমিকা পালন করবে, দে ডোন্ট ইভেন নো অ্যাবাউট হোয়াট কনস্টিটিউটস আ হেলথ সিস্টেম, তাই না? প্রভিশন গুলো কিভাবে হয়, ফর প্রফিট, নট ফর প্রফিট, পাবলিক সেক্টর, প্রাইভেট সেক্টর, দেয়ার আর ডিফারেন্ট ওয়েজ অফ ডুইং ইট। হেলথ সিস্টেম ইনপুটের মধ্যে আছে ট্রেনিং, ম্যাটেরিয়াল, বিল্ডিং, স্যালারি, cross cutting issues like communication mechanism, health management information system, all these things. And the oversight, এটার ম্যানেজমেন্টটা কিভাবে হয়, কিভাবে এটার উপর নজরদারি করা হয়, সেটারও বিভিন্ন রকম ইনস্ট্রুমেন্ট আছে, রেগুলেটরি মেকানিজম আছে। ঠিক আছে? তো আমাদের দেশের হেলথ সার্ভিসটা কিরকম সেটা খুব সংক্ষেপে আমি বলতে চাই। সেটা আমরা জানি অনেকটা, যে একদম টপ লেভেলে আমরা জানি হচ্ছে মিনিস্ট্রি অফ হেলথ আছে। মিনিস্ট্রি অফ হেলথ হচ্ছে পলিসি মেকিং বডি। পলিসি মেকিং এর আন্ডারে ডিরেক্টরেট জেনারেল অফ দ্য হেলথ সার্ভিসেস আছে। তারপরে ন্যাশনাল লেভেলে আমাদের বিভিন্ন ডিরেক্টর অফ বিভিন্ন ইনস্টিটিউট আছে। তারপরে ডিভিশনাল লেভেলে ডিভিশনাল ডিরেক্টর অফ হেলথ আছে। তারপরে মেডিকেল কলেজগুলোকেও ডিভিশনাল লেভেল ধরা হয়। তার নিচে হচ্ছে ডিস্ট্রিক্ট লেভেল। ডিস্ট্রিক্ট লেভেলে সিভিল সার্জন আছে, তার আন্ডারে ডেপুটি সিভিল সার্জন আছে। আর ডিস্ট্রিক্ট হসপিটাল গুলোতে সুপারিনটেন্ডেন্ট আছে। আমাদের একটা ভুল ধারণা, সামটাইমস উই হ্যাভ আ রং পারসেপশন দ্যাট সিভিল সার্জন is the head of the district hospital. It is not. District hospital is headed by a superintendent of the district hospital, but civil surgeon is responsible for other jobs, mostly public health jobs, but he is usually not from a public health background. That's another problem. আচ্ছা, তারপরে আরএমওরা কাজ করে উপজেলা লেভেলে। উই নো ইউএইচএন, এফপিওস, আরএমওস, এটসেট্রা। Then we have the union level. Okay, in the union level, we have the medical officer, then health inspector, assistant health inspector, and then at the ward level we have the health assistant and community healthcare provider, CHCP, যারা কমিউনিটি এজে কমিউনিটি ক্লিনিকে যারা বসে সার্ভিসটা দেয়। আচ্ছা, আমাদের যে সার্ভিসটা আছে, the public sector is actually bifurcated, as you know. It has it has a directorate general of the health services. There is directorate general of the family planning. তো ন্যাশনাল লেভেলে মেডিকেল কলেজ, এখানে ন্যাশনাল লেভেলে ডিজিএফপি সেরকম কোনো বড় ইনফ্রাস্ট্রাকচার নাই। ডিভিশন, ডিস্ট্রিক্ট লেভেলে, ডিভিশনটা কেটে দিয়ে, এটা ভুল, এটা ডিস্ট্রিক্ট লেভেলে ডিস্ট্রিক্ট হসপিটাল আছে। আর ফ্যামিলি প্ল্যানিং এ দেয়ার ইজ ম্যাটারনাল এন্ড চাইল্ড ওয়েলফেয়ার সেন্টার। In the Upazila level, there are Upazila health complexes. At the union level, union sub-center or rural sub-centers, and union health and family planning, family welfare centers in the under DGFP. At the ward level, we have the community clinics in both the sectors. So I'm not going into the detail. It's actually basically the same thing. So we are actually towards the end of because the time is short. But I'm actually going, I'll finish with some examples of health system related research in the context of COVID-19. Many of you are actually interested to do research, but if you want to do a health system research, স্বাস্থ্য ব্যবস্থা নিয়ে গবেষণা করতে যদি কেউ চায়, so there are three defining features of a health policy and systems research. It's a systems approach. Systems approach কি, যে everything is connected to another thing. So you need to keep that in mind. এটা শুধুমাত্র এক জায়গা থেকে আমি একটা ডাটা কালেকশন করে ছেড়ে দিলাম, that is not going to be a health systems research. It's much larger than that. It's multidisciplinary, and it emphasizes on policy and power. Okay, so some examples of potential themes and topics and questions of health systems research. So first type of health system research are studies assessing the differential impact of COVID-19 and the response on disadvantaged groups and identifying the root cause of the vulnerability. অর্থাৎ এই যে COVID-19 এর প্রভাব বিভিন্ন জাতি গোষ্ঠী, বিভিন্ন সম্প্রদায়, বিভিন্ন মেল ফিমেল, এই যে নানা জনের উপর নানাভাবে পড়তে পারে, সেই জিনিসটাকে বোঝা। এবং এই যে ভালনারেবিলিটি, কেন একটা গ্রুপ বেশি আক্রান্ত হচ্ছে বা একটা গ্রুপ কম আক্রান্ত হচ্ছে, সেই জিনিসটাকে বোঝার চেষ্টা করা। An example can be, what is the differential impact of COVID-19 on livelihood, and how does it affect the health of the poor people and low income wage earners, people who cannot work from home, etc. COVID-19 আমাদের লাইভলিহুডের উপরে, যেমন গরিব মানুষের, যারা আমরা তো বাসায় বসে কাজ করতে পারি, বাসায় বসে ক্লাস করতে পারি, কিন্তু কিছু দরিদ্র মানুষের তো আসলে বাসার বাইরে না গিয়ে তো কোনো উপায় নেই, তারা তো ওয়ার্ক ফ্রম হোম করতে পারে না, যেমন শ্রমিকরা। ঠিক আছে? সো হোয়াট ইজ দ্য ইম্প্যাক্ট অফ COVID-19 অন দেয়ার লাইভলিহুড? If you want to know it, it's a very good health systems research. Second is studies exploring power dynamics and political forces. Okay, power dynamics, political forces, histories and cultures, the পি ইন এইচপিএস, আর পি মানে হচ্ছে হেলথ পলিসি অ্যান্ড সিস্টেমস রিসার্চের পি মানে পলিসি, দ্য পি ইন দ্য হেলথ পলিসি অ্যান্ড সিস্টেমস রিসার্চ। এটার এক্সাম্পল হতে পারে which and whose evidence and knowledge is being used in decision making around COVID-19। এই যে আজকে কোভিড-19 নিয়ে আমরা কাজ করছি, এর জন্য তো এটার জন্য তো একটা এভিডেন্স দরকার, তাই না? এভিডেন্সটা দিবে হচ্ছে এপিডেমিওলজিস্টরা। আমরা কি এপিডেমিওলজিস্টদের সাথে কথা বলেছি? আমাদের ডিসিশন গুলো কে নিচ্ছেন? আমলারা নিচ্ছেন, নাকি ডাক্তাররা নিচ্ছেন, নাকি পাবলিক হেলথ প্রফেশনালরা নিচ্ছেন? কে নিচ্ছে এই সিদ্ধান্তগুলো? এটা কি আমাদের জানার দরকার নেই? আমাদের জানতে হবে না যে এই নলেজ গুলো কোথা থেকে আসছে, কোথা থেকে আদৌ কোনো নলেজের ভিত্তিতে কাজ করা হচ্ছে না খামখেয়ালি পূর্ণভাবে কাজ করা হচ্ছে? হাউ দ্য ডিসিশনস আর বিং মেড অ্যারাউন্ড কোভিড-19? This can be health policy and systems research. Now, the third, health system governance and decision making at national and global level. আমরা গ্লোবাল লেভেল বাদ দিই, স্টুডেন্টদের জন্য বা নতুন নবীন ডাক্তারদের জন্য তারা জানতে চাইতে পারে যে গভর্নেন্সটা কিভাবে হচ্ছে, তাদের হাসপাতালের গভর্নেন্সটা কিভাবে পরিচালিত হচ্ছে কোভিড-19-এ, কিভাবে তাদের হাসপাতাল বা তারা যদি একটা ডিস্ট্রিক্ট লেভেলে বা উপজেলা লেভেলে কাজ করে, হাউ দ্যাট গভর্নেন্স ইজ বিং ম্যানেজ। As for example, is there policy coordination or confusion through rapid policy change in COVID-19? এটা থেকে কনফিউশন তৈরি হচ্ছে, কোঅর্ডিনেশন কেমন হচ্ছে, এগুলো নিয়ে গবেষণা হতে পারে। নেক্সট, studies exploring how health systems are impacted by and support the COVID-19 responses. সিস্টেম লেভেলে, সার্ভিস লেভেলে, পাবলিক হেলথ সার্ভেইলেন্সের ক্ষেত্রে, টেকনোলজির ক্ষেত্রে আমরা দেখতে পারি যে কোভিড-19-এর ক্ষেত্রে আমাদের সাপোর্ট দেওয়ার ক্যাপাসিটিটা কিভাবে হ্যাম্পার্ড হচ্ছে, তাই না? এটার সাথে তো তোমরা খুবই ক্লোজলি রিলেটেড। তোমরা যারা হাসপাতালে কাজ করছো, তোমাদের উপর প্রেসার পড়ছে, তোমাদের জীবনের উপর একটা প্রেসার পড়ছে, এটা নিয়ে গবেষণা হতে পারে। হাউ ক্যান critical non-COVID services be maintained alongside the COVID-19 response in resource poor setting? আমি কোভিড-19 এর সার্ভিস দিতে গিয়ে আমার যে আমার যে একটা হার্ট ডিজিজের পেশেন্টকে আমি কিভাবে ট্রিটমেন্ট দিব, আমার একটা যে জেনারেল সার্জারির পেশেন্টদেরকে আমি কিভাবে ট্রিটমেন্ট দিব, তাদেরকে ট্রিটমেন্ট লাগবে না? তাদের ট্রিটমেন্টটা কিভাবে হ্যাম্পার্ড হয়েছে, ডোন্ট ইউ ওয়ান্ট টু নো দ্যাট? That can be a good research. You want to know what are the role of private sector actors in service response? কিভাবে প্রাইভেট সেক্টর সার্ভিস দিয়েছে, ভালো দিয়েছে না খারাপ দিয়েছে, কিভাবে তাদেরকে এঙ্গেজ করা যেতে পারে? উই ক্যান ট্রাই টু আন্ডারস্ট্যান্ড হাউ টু স্ট্রেংথেন দ্য ওয়ার্কপ্লেস সেফটি, অকুপেশনাল হেলথ ফর দ্য হেলথ ওয়ার্কফোর্স। ডাক্তারদের সেফটি, অকুপেশনাল হেলথ, এগুলো কিভাবে নিশ্চিত করা যায়, কিভাবে স্ট্রেংথেন করা যায়, এটা নিয়ে গবেষণা হতে পারে। How to support care for the carers, acknowledging anxiety, stress, fear. ডাক্তারদের মধ্যেও তো অ্যাংজাইটি, নার্সদের মধ্যে অ্যাংজাইটি আছে, স্ট্রেস আছে। How to support them, how to care for the carers. This can be a research. Then সেটা হচ্ছে যে studies exploring how the pandemic can inform the foundations of our more just, equitable and better health system. Are regional health actors and agendas strengthened, and how, with what consequences? Regional level এ আমরা কি আমাদের মানে আমাদের কনসার্ন গুলোকে কি অ্যাড্রেস করা হচ্ছে কিনা? হয়তো চট্টগ্রাম ডিভিশনে কনটেক্সট হয়তো খুলনার থেকে অনেক ডিফারেন্ট, তাই না? তো সেখানে সেই রিজিওনাল যে প্রবলেম গুলো, সেগুলোকে কি আমরা অ্যাড্রেস করছি, নাকি মিনিস্ট্রি অফ হেলথ থেকে যা চাপিয়ে দেওয়া হচ্ছে কেবলমাত্র তাই আমরা চিন্তা করছি? রিসার্চ গভর্নেন্স, রিসার্চ নিয়েও রিসার্চ হতে পারে। হোয়াট ইজ দ্য রোল অফ ন্যাশনাল এন্ড ইন্টারন্যাশনাল একাডেমিক এন্ড রিসার্চ ইনস্টিটিউশনস ইন সাডেন এন্ড র্যাপিডলি ইভলভিং গ্লোবাল হেলথ ক্রাইসিস লাইক কোভিড-19? আমাদের একাডেমিক ইনস্টিটিউশন গুলো, রিসার্চ ইনস্টিটিউশন গুলো, নিপসম বা অন্যান্য প্রতিষ্ঠানগুলো কিভাবে কোভিড-19 নিয়ে গবেষণা করছে? তারা কি আদৌ এটা নিয়ে গবেষণা করছে? তারা কি গবেষণা করার জন্য যেই মানুষগুলো ফিল্ডে কাজ করছে জীবনের ঝুঁকি নিয়ে, তাদের মতামত গ্রহণ করেছে বা করছে? এই বিষয়গুলো নিয়ে আমাদের চিন্তা করতে হবে। সো এই যে স্টাডি, এটা কিন্তু বেসড অন আ রিসার্চ, রিসেন্ট আর্টিকেল। সেই আর্টিকেলের রেফারেন্সটা আমি এখানে দিয়ে দিয়েছি। লুসি জিলসন, ব্রুনো মার্শাল, তারপর আইরিন আজিপং, খুব নামকরা হেলথ সিস্টেমস রিসার্চার। You can actually download this article and read for yourself to better understand the areas of health systems. I just gave some example, handful of example, but there are many other research areas that you can explore. You can try to understand. You can do it yourselves. So with this, I end my lecture, and thank you very much. Thank you for your attention so far.